Was your illness caused by demons? A lot of people in this country and in Africa as a whole believe in the supernatural, which they call demons. And from what I understand, that supernatural is good supernatural and bad supernatural, and the bad is the demons that cause illness and death. It is difficult to say whether this illness is caused by demons, because I have not seen demons. So it's difficult for me to confirm that this illness was caused by demons. What I know as a medical practitioner is that this illness is caused by conditions that have changed in the brain of the person who suffers the mental illness. Those ones I can confirm because research has shown what kind of changes happen in the brain when someone suffers mental illness, on which basis we determine what to treat. When we treat, my experience is that people get well. I'm not sure how demons influence that recovery. What I know is that the treatment we give does influence that recovery. That's why I'm unable to say whether your illness was caused by demons or not. What I know is that this illness is caused by malfunction of certain chemicals in the brain. Studies have been done, research has been done that has elucidated what happens in the brain at certain, in certain conditions of mental disorders, which we base on to determine what it is that you're suffering from. I'm aware that not everything scientific is examined in the laboratory. There are lots of conditions that you actually cannot test in the laboratory, not only mental conditions, but others as well. So the fact that we do not test mental illness in a lab doesn't make it any less scientific. We determine your medication depending on the nature of your condition, because we know that particular conditions have certain disruptions that cause them, and we know what substances will bring those disruptions back to order. We also know the kind of symptoms that come with particular conditions, and we know what substances will target those specific symptoms. So that's what we base on. That's the first thing that we base on in order to determine what to give you. For example, if we have examined you and found you to have a psychosis, we have substances we call antipsychotics. They target psychotic symptoms. They target those symptoms which come with a psychotic illness. We shall not give you medication that is targeting depression symptoms, because they are different. So we will be able to understand when we examine you the nature of symptoms that you have and the particular agents that target those specific symptoms. In addition to the symptoms, we determine what you need in terms of medication and how long, depending on who you are, on your age, on your current physical circumstances, physical illness specifically. We determine that depending on your weight, depending on other things that may be affected by the medication or that may affect the medication. We also look at what kind of adverse effects are likely to occur in a particular individual to determine what medicines. For example, if you have a heart problem, and we know there are certain medicines that may cause disturbances in the heart function, then we'll choose an alternative medication that doesn't have that effect. So depending on the circumstances of the individual and the illness they present with and the symptoms that come with their illness, we're able to determine what to give you. And for how long? Again, it depends on what you're suffering from. Some conditions can be treated for periods of time and we stop the medication. Others need to be treated into the long term. Others may be treated intermittently, others may need to be treated continuously. So depending on what you present with, after our assessment, we're able to determine for how long. Oh well, that's a very common question that many users ask us, and it's a pertinent question, I guess, because everyone wants to know how long they might be able to take their treatment and what happens if they don't take it. Some don't ask, they just dare not to take it. But on the whole, what happens when you don't take your medication? I think the obvious answer is you don't be well. The obvious answer is you don't be well. The way that mental illness is such that for many conditions, not all conditions though, but for many conditions, it tends to run a persistent course. For some, and I use persistent deliberately because for some, it's, as I said earlier, it's a waxing and waning course, in which case one needs to be at some point maintained on medication to prevent, the relapses from happening. So if that kind of person doesn't take their medication, it means they are going to get relapses, which in fact can be prevented. That's what happens. In other people, in certain conditions, the course is chronic, such that if they do not take their medication on a regular basis, the symptoms will persist and to a severe degree. And you want to reduce the severity of those persistent symptoms so that someone can function to some extent. So that's why I was saying the obvious answer is if you don't take your medication, most of the time you don't be well, because you'll be encouraging that persistence of symptoms or the waxing and waning of symptoms, which is very disruptive for most people. It disrupts your work life, it disrupts your school life, it disrupts your family life, it disrupts many aspects of your life and impairs the quality of life. So your quality of life will be very poor. So the answer to having a much better quality of life and some level of functioning in life once you have been affected by mental illness is to actually ensure that you take your medication.
Most people fail to be compliant because once they get a treatment and they feel better, they cease to see the need to continue taking treatment, because much of this treatment we have has side effects, and the side effects are not palatable. They are not good at all. They dampen your functionality. So they are a discomfort. So it takes a lot of effort to withstand those side effects at will. Most people do not withstand the side effects if they had a choice to. Either they abandon the medication or they try something else. But the options for treatment are limited. And much of the treatment is based on what is available. That's what is given. So if you explain to someone that when your condition manifests in ABC, and what we treat are the target symptoms. We treat these symptoms, and when they cease to manifest, it doesn't mean you have cured, because some of the conditions are chronic. So you need to continue taking the medication so that you manage the condition and you are on top of it to maintain a functioning level. That is something that cannot happen in a week or two that one spends on the ward. But you need to take him through and explain to him to understand and appreciate his condition.
That's a difficult question. How do I calculate the percentage? But that said, I believe that medication is very useful. It's very, very useful. I believe that 80 to 90% of the time, medication is helpful. Of course, depending on what you're suffering from. We determine, the value of medication depending on what condition you're suffering from and what is at stake. Okay. There are some conditions where you may not need medication. For example, when people have mild depression, it is still depression, but we have criteria for determining that this is mild depression, this is moderate, and this is severe. And what is at stake when you have mild depression is not the same thing as what is at stake when you have severe depression. So we can decide when you have mild depression that you don't need treatment. In that case, it may not be useful. We can give other therapies that may help. In moderate depression, we may give medication and combine it with other therapies so that two combined are helpful. In severe depression, for example, we often recommend that you should take medication because the symptoms are severe. What is at stake is a lot. The outcomes may be very adverse if we don't treat. So it depends on the condition. If we're talking about psychosis, for example, there are symptoms of psychosis that you cannot take away any other means. I mean, you can't use any other means to take them away. For example, some people have thought that if someone experiences hallucinations, they might be cancelled out of it, which doesn't happen. It is a core malfunction of the brain that needs something to deal with the chemicals I earlier talked about for one to be able to get well. So it depends really on the person. For most conditions, the value of medication is really significant. However, for some, it may not be as significant as in others. Yeah. You're asking whether you can ever or will ever stop taking medication. That is depends on individuals, really. Like I mentioned earlier, there are different conditions with different presentations, different levels of severity, and also different course and outcomes, which we call prognosis. If you are suffering, say, a first episode of moderate depression, we may be able to treat you for 9 to 12 months and stop the medication. In that case, there's room to stop. If we are treating your first episode of a manic episode, the first one, we may treat for a period and say maybe we stop and watch. So it depends at what stage of illness and what illness you're suffering from. I mean, that's what determines whether you will stop taking the treatment. There are situations, however, where we don't advise stopping the medication at all. And if you do, the outcomes are likely to be very adverse. So it depends. What I'm trying to say is that it depends on the individual, on the condition they are suffering from, the stage of the illness, the expected outcome or prognosis of that illness. That's what determines whether you will or may stop the medication. So it's very, again, it's very individualized.
First of all, the diagnosis needs to be right, because sometimes it's the wrong diagnosis. It will be wrongly diagnosed. And I've always wondered myself that, is there insight in non-compliance? Can someone have insight but remain non-compliant? You know? For example, someone tell you, I don't need medication. You know? He doesn't believe in medication, but he's got insight of his illness.
That is difficult to say, because one needs to examine the swelling to determine exactly what is causing the swelling, because there are many causes of tummy's swelling. A whole range of medical, not even psychiatric, but medical conditions, a whole range of chemical substances that may cause the abdomen to swell. So it's difficult to say why that happens unless a doctor has had a chance to examine and determine what causes that. But that said, it's not one of those things that happens to many people who are taking medication. It seems to be an individualized issue that needs to be investigated at an individual level. That's an interesting question. People worry about their babies at different levels. Some people worry about their babies while they are still in the uterus, while others worry about their babies when they are already born and, you know, they're being carried. I would say that just to encourage that we do treat pregnant women all the time, because pregnant women are part of the general population. They do get ill, and also people who have had mental illness do get pregnant. So it necessitates actually treating people who are pregnant. During that time, during pregnancy, we are careful about what we give during what period of pregnancy. We have 3 standard periods of pregnancies, which we call trimesters. The first trimester, which is the 12 weeks of the pregnancy, is the one where critical care needs to be taken to not damage the growing baby. So during those first 12 weeks, there are certain medications that we wouldn't advise or give to a woman who is pregnant, because we know from science and research that certain medications, not only mental health medications, by the way, medications across the board, even those that are used for treatment of other physical conditions, may harm the baby during that period. During the first trimester, the first 12 weeks, the baby's organs, the internal organs, are just forming. We call it organogenesis. They are forming, and that formation of organs may be disrupted by chemicals that get into that very little baby growing. After the first trimester, like in the middle 12 weeks, we don't worry too much about that, because the organs have already developed. So many drugs are safe at that point during the second and the third trimester. You can see even during malaria prophylaxis for pregnant women, we recommend that this be given during the second and the third trimester. So it's not only the mental health medications, but there are specific medications that we use in mental health that we wouldn't recommend during the first trimester, but may have no harm to a growing baby in the womb during the second or third trimester. So we may be able to stop them for a bit and then restart them, or just switch to something else. That's the baby growing. So will your baby be harmed? Yes, it depends. Yes and no, it depends on the time of the fetus. But that said, the percentage of babies that get harmed is extremely low for most of these drugs we are talking about. It is, for the most part, less than 3%. And in some drugs, it's less than 1%. So the risk, even though it might be there in the first 12 weeks, is really, really minimal. So you will find lots of women who take medication and they don't even know they're pregnant initially, and then they discover, and they deliver very normal babies because the risk is very small. So that is pregnancy, and it is small, and it is at a specific period. So on the whole, most of the medication we use is safe in pregnancy. Once the baby is born and is either breastfeeding or running around, most medications are safe. But we do exercise the same caution. But most of the babies who are born really don't have much effect, because to start with, their bodies have grown up a little bit more than those who are in the uterus, and their bodies may handle these medications slightly better than those that are in the uterus. But we are aware that when babies are still infants, their bodies are not as developed as for older children and adults. So we may be cautious. But on the whole, even though we exercise caution, it is not a time when we say, don't take medicine because you have a baby. No. We instead weigh the risk against the benefit. We call it a risk-benefit analysis to determine which one is riskier. If you have mild depression, we might say, well, maybe you don't need to take medication. Breastfeed your baby. We shall do psychological therapy. Yeah. But if you have a severe mental illness, an acute relapse of mania, we are going to give you the medication even when you're breastfeeding, because we know the risk to the baby will be really minimal, and the risk of not treating you, the mother who has a baby dependent on you, is much higher than the risk of not treating. That depends on what your idea of recovery is and what you mean by a full recovery. I might want to ask what you mean by a full recovery. Recovery is possible for most users, I would say that. As I mentioned earlier, there are some people who unfortunately get a very chronic course of illness and may have this persistent condition that seems not to respond to medication adequately. But that percentage is really small. Most of the time, most of the people will achieve some level of recovery. That is if you do not think that recovery is cure. The two are different. Recovery is something to do with control of symptoms, as well as understanding of one's illness, being able to harness it and manage it and deal with it and move, function despite the illness. Understand it, be able to talk about it. That for me is recovery. That despite the illness, you're able to live and live a productive and fulfilling life. If you expect recovery to be cure, then the answer is probably a straight no, because not everybody cures. But most people, the majority of people, are able to reach that stage of recovery if they are supported to that level.
Recovery means, to me, a certain period or that long time you have taken without relapse. then nga kati banatabira ku ward na spending like 3 years without coming back to the hospital. In that period, abamu recover. But if you on the ward, tobamu recover. What already recovered? Recover kitegezo n'ekintu kyovuddemu. Wabanga omuntu abadde ku ward, n'ava ku ward, n'addayo mu community, n'akola bulungi emirimu gye, however much ajja ku for review, n'aspendinga time eyo nga ali waka akola emirimu gye wadde still mulwadde, aba ali mu recovery.
Is bipolar disorder curable? That's a tough one. Like we have already said, cure is something that we rarely talk about in mental health. If you suffered from malaria, yes, you get cured. If you had a bout of diarrhea, yes, you may get cured. But with mental illness, we talk more about recovery than we talk about cure. The nature of mania, bipolar disorder, is such that it's a waxing and waning condition. You get an episode, you get well, and in between, there are no symptoms at all. If that is what cure is, then maybe yes. But we know that it may recur at a certain other time later. And you may get, these episodes up and down. If we look at the whole course across a number of years of bipolar disorder, we might say maybe it doesn't quite cure, but people do recover in between their manic episodes. But if that period of recovery equals cure, then maybe that's what it is. It depends on how you look at it. Recovery is what we talk about, and people with bipolar disorder fully recover from their symptoms and from their dysfunctions. They're able to go back to work, they're able to marry, they're able to have babies, they're able to go to school, they're able to live a productive, fulfilling life. That is the beauty of bipolar disorder. It is treatable and people do recover. It's not a death sentence, it's not doom. It is manageable. But because of the known cause of the illness, these episodes may recover at some, reoccur at some point in the future, which will again need to be dealt with. So because of that, when someone has had a number of the relapses, we advise that they, keep on their medication to maintain that normalcy, to maintain the normal mode. And if they do that, they go for years without a problem. So I'd rather talk about recovery, full recovery, rather than cure. I think recovery is a journey for most people, and how long it takes one person to recover may not be the same as the other, because it's dependent on very many things. First of all, whether you have had access to treatment, whether you have been identified early enough, whether you have support from others, whether you're willing to take, the recovery advice, whether things are in your environment that support your recovery. Very many things come into play when we talk about recovery. So it's very difficult, and they're very different for different individuals, really, because all of us come from and live in different circumstances. So basing on, all those circumstances around somebody, the recovery journey may be very different, may be much shorter for some people, and yet much, much longer for others. So it's difficult to say how long. what is important to do is to harness everything in your environment that can foster your recovery. And if we have all those in place, then the recovery will take much shorter than if we didn't have, all those supportive things in the environment for your recovery. Is it possible for you to get married and have no more children? Absolutely. There's no reason why anybody with mental illness shouldn't get married or have children, because to start with, they most of the time they have normal body physiology, just like other people. So they do fall in love, they get attracted to other people. They can engage if they are in that phase when they have recovered. They can actually emotionally engage, and their warmth haven't gone away. When they get mental illness, they can have babies. Can they have normal babies? Yes. As we mentioned earlier, when we talked about whether babies will be harmed, the risk to the babies of people with mental illness when they're on medication is low. So they do many times have normal babies. We have delivered lots of women in hospital, on the ward, who have been having mental illness for years and have been on medication for years, and they're having babies, and the babies are normal. So I'm very sure. To start with, I think when you get mentally ill, it doesn't take away your right as a human being to engage, to socialize with other humans, to engage emotionally with anybody, if the other person is willing. And many of the people we treat in our hospital are married men and women, actually. And they're mothers and fathers who have young and older children. So it doesn't take away your right or your ability to engage and marry, or to have children, or to have normal children. Is it possible for service users to be gainfully employed? Why not? We just talked about recovery, and we said when recovery occurs, one is able to function. They're able to engage, they're able to live, a normal life, or near normal life. Yes, they can be gainfully employed. I gave an example of people with bipolar disorder who tend to have full recovery in between their episodes. They function like normal people. So when they're not ill, they're able to find jobs if they have what it takes to be gainfully employed. So they can be gainfully employed. They can also start their own businesses, and they make it work. There's no reason why they shouldn't. In fact, we encourage that they should be gainfully employed.
But when you go to a job like public service, the forms on public service ask, have you ever been to a psychiatric facility? Have you ever been to a mental hospital? What is the rationale of that question on forms of public service? It is basically to eliminate. If it was helpful that if you have been to a psychiatric hospital, we are going to help you, give you the easy provisions, give you the soft landing, give you this support, enable you in this way, that would be helpful. But you indicate and tick that box that you've been to a psychiatric hospital, that is a total knockout. That's the disqualification straight away.
Can a peer support worker be fully recovered and be gainfully employed and have an impact in the community? Yes, the writing is on the wall. We have had a number of peer support workers in our hospital who we have treated in this hospital who have recovered fully, who have gone on to do training and workshops and have now been helping us to support other people who break down with mental illness. They are being useful in the community. There are many people who are also gainfully employed and they are still being treated here. They come for their medication all the time and they are in gainful employment. The fact that one has had mental illness at some point in their life does not stop them living. They're still living in this world. They still have many of the abilities of normal human beings and can actually engage in gainful work and community activities and have a real impact. So peer support workers, definitely, by the time they are peer support workers, already it shows that they are having an impact. So the writing is on the wall. Health providers are part of the general population. Because they are part of the general population, they can get ill. They can suffer from anything else that everybody else can suffer from because they're human beings. So what happens to them? We do treat them and we do support them. We are there for them, just like we would be for anybody else who turns up to be ill. They're entitled to free services, just like other Ugandans. They're entitled to therapies, just like other Ugandans. And in fact, they are a very powerful force because they work like peer support workers. They turn out to be very good providers. Being able to understand illness by experience, being able to understand the experience of having to take medication, they turn out to be very good supports for the patients that they manage. So that alone helps them on their journey of recovery, the fact that they are helping out other people. But the support that we give them as providers is just like the support we give, the other people that we have. Free services is what we provide them, and as much as we can to ensure that they remain fully functioning, because we need them. They are providers.